I have 6 grandchildren. 4 of them are close by, and they're very active kids, and it's very important for me to have that closeness with my grandkids and be able to do the things with them and play. I have spent 40 years as a nurse, and most nurses I know have had problems with their legs, their feet, their necks, their hands. I had problems with my thumb, and it got to the point where it was hurting so badly, it was throbbing, it was atrophying, it was the muscle was shrinking on me, and it would wake me up at night because it was so uncomfortable. So in 2012, my husband passed away, and I had even more challenges, of course. Having to take care of myself, fixing the house, doing everything that needs to be done when you own a home, it became very difficult because I couldn't use both my hands as well.
What were her options? She went to a surgeon. She was a surgical candidate, but their options are poor at best. The literature is quite clear, and patients are pretty miserable. They take a tendon and wrap it around, or they fuse the joint. Imagine a fused joint in the thumb. Not a great option.
My thumb would throb and ache and pain at night, whether I did ice. I even had a splint made for it, and it just got to the point where I would pick up something with my left hand sometimes when I'm in a hurry and forget, and I would drop it, glass, and either I'd spill something or I'd break it. I'd drop plates. But then towards the end, it was to the point where if I picked up a magazine, I could hardly just even hold on to it without it falling out of my hand.
First and foremost, we acknowledged there was a correlation between her cervical spine and her thumb. She had narrowing of the nerve, the foramen, where the nerves came out, so there was compromise of the nerves that power the muscle that control the thumb. That's the first tenet. Number 2, she had some arthritis in the joint. And number 3, under diagnostic ultrasound, we were able to identify significant laxity of the supporting ligaments around that thumb. So it's not just about the joint.
That we decided to do the PRP procedure, and that was one of the best decisions I ever made.
In Deborah's case, what we did is we injected again the cervical spine, enhancing the neural flow along the nerve roots that control the muscles in the forearm and thumb, and we also injected into the joint under ultrasound, and then finally we addressed the loose ligaments in a circumferential fashion to address healing and stability.
Within 2 or 3 weeks, I had no pain at all. I can pick up my grandson, I can do the things I need to around the house and the garage and the yard, and it has helped me feel more whole again and not afraid to be alone and trying to manage things by myself.